very similar to recognising it in the limb. It's when edema is apparent, it's obvious that there is an increasing size of the tissue. The patient will tell you that they've got problems probably before you even see it, and they can often feel that there's problems there before it even manifests. And that's the first stage of lymphedema, known as the latent stage. So quite often it's obvious, but it goes through the same changes as it would in a limb. So you would get pitting edema in nature, and as the disease or condition progresses, it'll then start to change. So we'll see skin changes, we'll see an increase in size, but a decrease in the ability to do the pitting test. And that's when problems and skin starts to break down as it starts to manifest. Stemmer sign or stemmer sign, it's sometimes pronounced that way, is the inability to pick up your skin at the base of the second toe. So if you imagine this is your toe, your great toe, your second toe, it's the inability to do that. So you would be kind of picking up almost like a wedge. And that's a positive stemmer sign, and that means that there is edema established within the tissues, and it's a diagnostic test for lymphedema. If you're using bandages, then we tend to take the bandages out laterally, and we do most of the bandaging so it's coming over the top of the foot. We go lateral because that's the natural pathway of the lymphatics to go out laterally. What we don't want to do is create too much bulk underneath the foot, because if somebody's walking around, it will alter the gait and the biomechanics of the body. So we need to keep that nice and slim. Got beautiful vascular area underneath the foot, which we often forget about. So we need to make sure that that's looked after. If we're looking at other options other than bandages, we can get off the shelf and made to measure toe caps. So they look like little fingerless gloves, but they're for your feet. And there's different materials that allow us to do those. So there's lightweight, silky ones, or there's much kind of stronger flat knit garments that are made to measure. And then there's you sort of in between. But most of the companies provide a range of toe cap garments for patients.